Physiotherapy is a subject that many don't take seriously, but according to what the specialists say, it helps in improving the well-being of the human body. Now, how seriously is it practiced here in Ghana, and what do we need to do to make sure that it is available to every Ghanaian living everywhere? We have in the studio Dr. Jonathan Quarty, and he is the president of the Ghana Physiotherapy Association and also the president of the World Confederation for Physical Therapy for the Africa region. And thank you very much, Mr. Quarty.
Yes.
Okay.
Yeah, thank you very much,
Roland. Now, basically tell us about physiotherapy and its origins in Ghana, if we have to trace a history, so to speak.
Well, physiotherapy is a healthcare profession that provides services to persons to be able to maximize their movement and functional ability throughout their lifespan. Essentially, that is what we do. And
that's very scientific. Means what?
Movement. That's what movement and functional ability. That means the ability to be able to move, because situations and conditions will arise that will cause inability to be able to move. So I'm saying movement and functional ability throughout lifespan. That is very important, and that is the basis of our job. We use our hands, we use lights, we use water, we use electricity to be able to treat our clients, when they come through to us.
At what point would you need physiotherapy? Because what we've come to notice is it's only when somebody has a certain burn or has an accident or has a minor stroke or some kind of relative deformity.
Well, you need physiotherapy. You could need physiotherapy at any point in life and even at birth. And there are conditions, what do you call it, diseases that could probably, predispose you to have to come for physiotherapy. In children, they vary, but the easiest I can tell you is about maybe children who are born with certain deformities, or they are unable to grow for certain reasons that may have caused that particular disability. We have things like cerebral palsy that we probably have heard of. We have Down syndrome, all those childhood conditions. And then for adults, we have things like cancer, we have repetitive stroke injury, strain injuries, we have Parkinson's disease. All the conditions that can cause the person not to be able to move properly. And that's why I emphasize on the word movement and functional ability throughout one's lifespan. That is the basis for our job.
And under normal circumstance, is every health facility in the country, or even the major health facility in the country, is expected to have a physiotherapy outfit, department or center? And why would that be critical?
Yeah, ideally, every facility should have, a physiotherapy center. But fortunately for us, I think every regional facility in Ghana does have a physiotherapy facility, and some districts do have. But it could have been better. It could have been better, because you never know when you need physio. And let me also just remind you that we also are supposed to offer services within the community itself. Because one of the things that I think we see on a daily basis is about neck and low back pain, which arise as a result of poor postures that we usually assume when we do our work or when we do our daily activity. Yes. So physiotherapy is something that is needed anytime, everywhere. Even, for instance, this program alone, probably if we had a topic we are discussing, could be able to lead to prevention of one or two conditions that probably could bring you to the hospital, for treatment.
Yeah. We'll talk about the conditions precedents and then how preventive people can be as far as the subject of injuries, and so that they can avoid or they can also get help as far as physiotherapy is concerned. But would you say that as a country we have enough professionals undertaking physiotherapy?
No, I wouldn't say so. If I'm very right, at the moment, I think that our total strength as far as numbers is concerned is about 150. Across the whole country.
You mean certified?
Yes, certified. And I think that it is actually woefully inadequate.
Per the population we have.
Per the population. I mean, for the country's needs. So I think the numbers are they're not the very best.
Yes. So where's the training undertaken?
Currently, the training is being done at University of Ghana, where
the medical school.
Well, it's College of Health Sciences. Under the college, we have it's the School of Allied Health Sciences, where you have the physiotherapy program running. And averagely, about 25 to 30 physios are produced, I mean, per year. And the program started only in 2001. But hitherto, the training was outside the country. So they come in small numbers, maybe 10, 15 max. I mean, I think the last group that went out came with about 17 or 18 physios. So the numbers are not the very best. Fortunately, the university in Ho, University of Health and Allied Sciences, is also starting a physio program. We are hoping that all would be able to improve the numbers. But at this moment, the numbers are not anything to write home about. Yeah.
I've been doing some interaction with patients who are undergoing some physiotherapy, and they say it's expensive. Why is that?
Well, I wouldn't say that physiotherapy is expensive, because majority of the physiotherapy facilities that we have in this country are, I mean, government hospital based, and I don't know how come they say it's expensive, because if you compare the charges or the fees that the hospital collects to those who are in private practice, you would realize that there is a certain disparity, I mean, in the charges. Well, it all depends on the individual's pockets. I think probably that's what makes them say it's probably expensive. Let me just say one thing. You know, physiotherapy is something that you have to do over a period of time. And probably that is why they would want to say that it's expensive. Because if you accumulate it, then I mean it becomes maybe a sizable amount of money. Because you can't come for physiotherapy once and then everything is okay. You have to come a number of sessions per week, and probably it runs into a couple of weeks. I mean, to be able to get you functionally, I mean, fit to go back to do what you normally do. Yeah.
As an association, how do you sanitize an environment in which now we have a lot more private practitioners who necessarily may not have the needed training? And it's a worry for some of the professionals, and especially those administrators at the headquarters of the Ghana Health Service.
Well, fortunately for us, at the moment, we have the Allied Health Professions Council, and that is their primary duty, to be able to certify that somebody has gone through the program, give the person a license to practice, and that license has to be renewed on a yearly basis, and therefore, I don't think that we should have a big issue. Well, what we need to do is that we have to put our ears on the ground, and if you hear or know of anybody practicing somewhere that you're not too sure of, if you let the association know, we present that fact to the Professions Council to go and do an investigation and check. If that person is not, I mean, qualified to practice, he or she will be dealt with according to the laws.
Is that possible that somebody is a professional physiotherapist but is not part of your association?
Yes, it's possible. It's possible.
And so we have a number of them around.
Yeah, but the bottom line is that they must register with the Allied Health Professions Council. That is very important because, well, in democracy, they say there's freedom of association. So the person is not obliged to be with the association, but has to be with the Allied Health Professions Council. Unfortunately for us, again, I mean, to be able to register with the council, you must go through the association. And therefore, we more or less have a fair idea of the number of persons who are practicing in the country.
Just like the Pharmacy Council or Association of Registered Pharmacists, etc.
Yeah.
They also they face problems with quack drugs or quack pharmacies, etc., or fake drugs, etc. Do you know that in communities, people have all these machines, etc., they use to undertake physiotherapy? Have you checked whether those people are professionals?
Well,
they put the machines on you and they said you have a problem. Well, now you have to go through sessions.
Well, some people do call themselves physiotherapists, but they are not physiotherapists. And now we know. Fortunately, again, it's because of the Allied Health Professions Council. We have the mandate to be able to go there and say that, look, what you are doing is not right, or, I mean,
when do you
need to
intend
stop,
going there?
stop,
because you
stop
say you
doing,
intend
doing
going
there.
there. When do you intend going there?
I'm saying that those that we know of, these actions have been taken.
Okay.
I mean, we don't know everything, but the reports do come, and when they come, we actually take these actions and report to the council. So maybe there's a specific one that we don't know about. If you let us know, I'm sure we'll take action on it.
These are observations of a number.
Observations. Okay. Okay. Number. Yeah, those that we know we are working on. Those that we know we are working on.
Now the illnesses that physiotherapy can address, they range from.
The illnesses
that physiotherapy can address.
Any illness or condition.
Mainly.
Like I said Parkinson's disease, stroke, cancer, repetitive strain injuries, low back pain, neck pain. I mean, anything that has that causes limitations to your movement. I mean, we would address. So any medical condition or trauma, I mean, that causes that. Usually, at the end of the day, will be referred for physiotherapy when deemed necessary by the attending physician. Yes.
There are concerns among some of the departments in the health facilities that they don't have enough facilities at their physiotherapy wings.
They don't have enough facilities?
Yes. For example, you go to, I don't want to say Kolebu first, but you go to a health facility in Ghana, sometimes they don't have enough facility to undertake physiotherapy because sometimes somebody's problems may involve maybe you doing the physiotherapy in water or, you get what I mean?
Oh, well, I don't think that facilities should be the problem. I'm thinking more of the human resource. In Kolebu, for instance, I mean, Kolebu is a huge hospital, I mean, where you have various departments and various units who see a wide range of conditions from pediatrics to adults, surgical, medical. It's very wide. And these are people who go onto the wards to see patients. They see patients, I mean, on outpatient basis as well. And you realize that the staff strength, I mean, is not anything to write home about. So if it's about facilities, I'm sure it's more with a human resource. I think that we need more personnel to be able to undertake, I mean, some of these things. However, it's possible that some of the facilities across the country do not have the needed equipment to be able to perform, I mean, to their maximum best.
The Ghana Physiotherapy Association, how do you hope to complement the inadequacy of personnel in the health delivery or in delivering physiotherapy to a lot more people? How do you hope to lobby, perhaps even advocate for a lot more people to be trained?
Well, I think that if we have more facilities doing the training, I'm sure on a yearly basis the number of physiotherapists that will be turned out would increase. I mean, for instance, University of Health and Allied Sciences is coming up with a physiotherapy program. I mean, they will increase the numbers. Also, well, the universities are also actually very tight, so they always have a quota of the number of students they want to take in for the training. But I think that by and large, if we have more training facilities, I mean, the more universities are training, I'm sure the numbers of the physiotherapists could pick up and it would help to a very large extent.
If people have difficulties, let's say they've had a stroke, they've had arthritis, Parkinson's, etc., how quick would they need physiotherapy? And
I would say almost immediately. What matters is that the first and foremost thing that will be done is that they'll be stabilized medically. I mean, the attending physician would make sure that everything is stable. They are right at the time to be able to start the physio. So if somebody comes in, for instance, with a stroke and the blood pressure is high, once the blood pressure is stabilized, everything is okay, and the person is ready, physiotherapy starts. So physiotherapy starts within hours of being able to stabilize the patient who has reported with a particular condition.
In undergoing physiotherapy, are there certain risks?
There isn't any major risk. I mean, if you have to do physiotherapy, there's no major risk at all. What we do or the things we use, I mean, do not have any major risk associated with it that could harm our clients at all in any way. Yeah.
Okay. There are some who do the spinal, how do they call it? for those who have difficulties, whether they have back problems, etc. Is that also treated with physiotherapy?
Yeah, physiotherapy, we treat spinal cord injuries, we treat neck pain, we treat back pain. We treat anything, any condition within the orthodox health delivery system, that comes to us can be treated.
I was referring to those who, now we have a specific group of specialists who perhaps were trained in America, okay, and they treat especially bone and spinal injuries and all. So for example, we have the spinal clinic, etc. I don't know whether you've heard of them. And is that another form of physiotherapy?
No. I think I have an idea of what you're talking about, but we don't work with them in the hospital.
No, I know. I'm not saying you work with them.
So we are talking of the normal orthodox, healthcare delivery system. They are complementary, or is it alternative? Medical practitioners. So what we do is very different from what they also do, and I think that I would want to stay and focus with physiotherapy.
Right. We have to wrap up our discussions, but how crucial is it that people tend to access your services as and when they would want it, or what sort of education would they need to make sure that they always get access to your services?
I think physiotherapy is very accessible, very, very accessible. We also, can see patients if they come directly to us. We can assess them and treat the condition. Once it's within our purview. If it's not within our purview, of course, we'll refer them to see a physician or something. So I think we are very accessible, and we have facilities across the country, including a few private facilities here and there. So physiotherapy, in my opinion, is very, very accessible.
Any numbers people can reach the association in case they have difficulties, they want to clarify things?
If you go to our website, www.physioghana.org, all the telephone numbers that you probably will need are there. There are 3 major telephone numbers that one could easily access.
Okay.
Yes.
www.ghanaphysio.org.
Ghanaphysio.org. Yes.
www.ghanaphysio.org.
Yes.
Well, that'll be it. And we've had in the studio Jonathan Quarty, the president for the Ghana Physiotherapy Association, as well as the president for the Africa region of the World Confederation for Physical Therapy, talking to us about physiotherapy, how critical it is, how also crucial it is for any individual who has had any difficulty or injuries to get access to any form of therapy as far as the body is concerned. And thanks for joining us, Jonathan. We hope to have you again sometime.